Welcome to NYK Naturals Ayurveda Academics. In this video, we are discussing a topic, Dacrocystitis. It is very important topic for upcoming university examinations. It is given under Sandhigata Roga 1 in that Puyalasa and Upanaha. In their correlation, this is given, that is Dacrocystitis, both acute and chronic Dacrocystitis. Let's first discuss about chronic adult Dacrocystitis. Here in A.K. Kurana book, the very first line is given in chronic Dacrocystitis is chronic Dacrocystitis is more common than acute. Here I have one question for everyone. We studied many diseases, no? In that every disease first start as acute, then it converts into chronic. But when it comes to Dacrocystitis, why chronic is more common than the acute? Comment your answer. Okay, let's start with chronic adult Dacrocystitis. Mainly, first here etiology. Chronic adult Dacrocystitis is a multifactorial disease. Here the cause is, many causes are there. It is a vicious cycle involving stasis and mild infection. What we are stasis of the lacrimal fluid. Okay, it leads to infection. Infection again leads to stasis. It is a chronic vicious cycle. It is having many causes. Let's discuss etiology under subtopics. First is predisposing factors. Here it is commonly found in 40 to 60 years of age group and more common in females and more common in white peoples. And when it comes to socio-economical status, in low socio-economical status groups it is more common. And poor personal hygiene is also one of the predisposing factors for Dacrocystitis. Okay, then factors responsible for stasis of the tear in lacrimal sac. Now here stasis is occurring, no? For that some factors are explained. First one is anatomical factors. Due to narrow bony canal, partial canalization of membranous nasolacrimal duct, excessive membranous folds in the nasolacrimal duct. Then I will explain this topic first. This is the lacrimal apparatus. Okay, here comes nasolacrimal duct. Nasolacrimal duct. Here it should be wide enough to drain the tears, to drain the secretions. But if it is narrower or if there is a membranous folds, it leads to lacrimal stasis of the tear. It leads to Dacrocystitis. Okay. Then these are the causes I explained there. Then foreign body in the sac may block the opening of the nasolacrimal duct. Let's draw here only one. For example, it is the lacrimal sac and it is nasolacrimal duct. Okay. In the sac, if there presence of foreign body, this foreign body obstructs the nasolacrimal duct and leads to stasis of the tear in the sac only. It further leads to Dacrocystitis. It is one cause. Okay. Then excessive lacrimation causes stagnation of tears in the sac. Here production only more, so it leads to stagnation of the tears. Then mild grade inflammation of the lacrimal sac. Any kind of inflammation in the lacrimal sac that is mild, that also leads to Dacrocystitis. Then obstruction of lower end of nasolacrimal duct. Here this is the nasolacrimal duct. No, here it drains out. Here the lower end, if it is obstructed, how? Either by nasal polyp, hypertrophied inferior concha, deviated nasal septum, tumors, atrophic rhinitis. These are the some nasal pathologies. This causes obstruction of the lower end of the nasolacrimal duct. It further leads to stagnation of the tear in the lacrimal sac. It leads to dacrocystitis. I hope the factor responsible for stasis of tear in lacrimal sac is clear for you guys. Then source of infection, like conjunctiva. From conjunctiva, the infection may spread to lacrimal sac or lacrimal apparatus, from the nasal cavity, from the paranasal sinuses. Why? Because these all are the structures present nearby only, no, for the lacrimal apparatus. That's why these causes leads to these sources act as a source of infection, which leads to dacrocystitis. Then causative organisms, we already know these are some familiar members: staphylococci, pneumococci, streptococci. These are the common bacteria. They only going to cause dacrocystitis. This is all about etiology of the chronic adult dacrocystitis.